It's Friday, September 24, and this is your Barbados Today Evening News Update. Prime Minister Mottley took the international community to task for its failure to act on a range of critical issues facing the world. Addressing the United Nations General Assembly today, she lamented that 3 years since making her maiden speech to the group, little had changed despite increasing perilous challenges. She insisted that global moral leadership is needed now more than ever, as she demanded answers on what more it will take for leaders to stand up.
How many more variants of COVID-19 must arrive? How many more? Before a worldwide action plan for vaccinations will be implemented? How many more deaths must it take before 1.7 billion excess vaccines in the possession of the advanced countries of the world will be shared with those who have simply no access to vaccines? How much more fake news will we allow to be spread without states defending the public digital space? We've come together with alacrity to defend the right of states to tax across the digital space, but we are not prepared to come together with the same alacrity to defend the rights of our citizens to be duped by fake news in the same digital space. And how many more surges must there be before we ask, when will the world take action? None are safe until all are safe.
The Prime Minister warned that the world continues to gamble with its future, and now is the time for leadership. She questioned who will sign the new charter for the 21st century that will bring hope and progress to the world's people.
Who will get up and stand up for the rights of our people? Who will stand up in the name of all those who have died during this awful pandemic? The millions. Who will stand up in the name of all those who have died because of the climate crisis? Or who will stand up for the small island developing states who need 1.5 degrees to survive as we go to COP26? Who will stand up? Not with a little token, but with real progress. And who will stand up for all in our countries who remain and suffer the indignity of unemployment and underemployment, and whose access to food is now compromised by increased food prices and increased transportation prices, and transportation, quite frankly, that is being manipulated. It is not beyond us to solve this problem. If we can find the will to send people to the moon and solve male baldness, as I've said over and over, we can solve simple problems like letting our people eat at affordable prices and making sure that we have the transport.
Opposition Leader Bishop Joseph Atherley is calling for a commission of inquiry to be set up in what he has termed as Vaccine Gate. He says the apparent scandal surrounding the purchase of COVID-19 vaccines on behalf of the country demands a full investigation. Last week, Radical Investments Limited, whose principal is named as local businessman Mark Moley, filed the lawsuit claiming to have been deceptively lured into an elaborate US $10.2 million scam for 1 million non-existent doses of the AstraZeneca vaccine through a Florida company, Good Vibrations.
I find it my duty to call upon our Prime Minister to have mounted an official inquiry into the circumstances surrounding the failed attempt of the government to acquire a quantity of vaccines through the agency of a private company. This matter is now the subject of wide media exposure, much public speculation and controversy, and it is also the subject of court-related action. Now, a transaction attended by such serious public allegations involving multiple companies, as alleged, at least 3 Caribbean governments, ex-regional countries, and an international manufacturer, cannot easily or simply be addressed by brief comments from an acting Prime Minister and a Minister of State working in the Ministry of Finance. What is swiftly becoming what some people are already calling vaccine gate has the potential to smear this country's reputation.
A 55-year-old Guyanese woman who resided in Barbados is the latest person to succumb to COVID-19. The Health Ministry reports that she died on Thursday in the primary isolation section at the Harrison's Point Isolation Facility after spending 22 days. She was unvaccinated. The number of lives lost to COVID-19 in Barbados now stands at 64. Meantime, the Barbados Santos Public Health Laboratory confirmed 167 new cases of the viral illness. 38 of these individuals are under the age of 18, and the remaining 129 are in the 18 and older age category. There are 857 patients in isolation. Since March 2020, Barbados has recorded 7,232 cases. To date, 100,802 persons, or 37.2% of the population, have received their second dose and are fully vaccinated. The much-touted housing project at Todd St. George is now in the hands of the Ministry of Housing. Contractors officially handed over 15 houses today to Minister Dr. William Duguid, Minister Peter Phillips, St. George South MP Dwight Sutherland, and officials from the National Housing Corporation. Minister Phillips told reporters it's a significant step in government's mission to ensure more Barbadians own a piece of the rock.
There are 15 contractors were involved in the project. They were each given a house, and they actually come in very early. And this is testimony to the fact of what can be done in Barbados, what our small contractors are able to do. There are 10 two-bedroom houses, 1 and 5 one-bedroom houses, which can be expanded at the whenever the owner so decides to do. So I'm happy here this morning to be able to receive these on behalf of the National Housing Corporation, on behalf of the ministry and the government and people of Barbados. We are really looking to put a dent in the number of housing requests that we have from them. We've had over the years, and housing is important, and everyone wants to own a piece of the rock.
The St. George South MP Dwight Sutherland says the project not only delivered new homes, but empowers small contractors and provides jobs for a number of people. He assured residents that this is only the start of the government's plan to ensure Barbadians have access to quality housing.
We were able to empower, as a government, small contractors. These houses were built by excellent builders, and when you go inside you can see, I had the opportunity to visit a few of them, and the work is extremely of a extremely high quality work. And not only the work, but we were able to employ persons from within the various communities where we built houses, not only in Tars but in St. Philip and in St. Lucie, and that speaks to empowering people, putting bread on their table. At a time like now, COVID-19 has impacted Barbados in a fundamental way, the world, but we have to focus here on us to ensure that our people get their fair share of work, get their fair share of what I call a piece of the rock.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional happenings, the Trinidad and Tobago government has instituted safe zones for vaccinated people. As part of lifted restrictions, the curfew hours will be adjusted from next Monday, while safe zones at entertainment establishments and in-house dining will be allowed for fully vaccinated people from mid-October. More in this report from TTT News.
So from Monday next week, the nighttime curfew begins at 10 o'clock.
This is one of the announcements by Prime Minister Dr. Keith Rowley, another being the opening up of bars, restaurants, gyms, cinemas and casinos to vaccinated persons over 12 years from October 11th. Minister Stuart Young says owners of these establishments will have to ensure staff and patrons are fully vaccinated.
The owner of the establishment will be subject to a fine that we're working out now, and we're also looking at a tiered penalty system.
These establishments will operate at 50% capacity and alcohol consumption will still be prohibited in bars and restaurants, although in-house dining is allowed. And Dr. Rowley says masks are still a must.
On the international front, the U.S. Centers for Disease Control and Prevention, CDC, on Friday backed a booster shot for the Pfizer/BioNTech COVID-19 vaccine for Americans aged 65 and older, adults with underlying medical conditions, and adults in high-risk working and institutional settings. More in this report from Reuters TV.
The decision by CDC Director Rochelle Walensky is aligned with the U.S. Food and Drug Administration's authorization for a booster shot earlier this week, but goes against a CDC panel's recommendation for a narrower booster rollout. Walensky's decision paves the way for not only the elderly to get the booster shot, but also teachers, healthcare workers, and anyone in a high-risk job. President Joe Biden on Friday said the U.S. is ready to give out the dose.
We bought enough booster shots, and states and pharmacies, doctors' offices, and community health centers have been preparing to get shots in arms, booster shots in arms, for a while. And like your first and second shot, the booster shot is free and easily accessible.
Scientists have been divided over the need for booster shots for the COVID-19 vaccine, with some, including those from the FDA and the World Health Organization, saying there is inadequate evidence that they are needed by anyone other than older people.
That's news, but for the very latest, you can visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Capital Media HD 99.3 FM.